So while hospitals are stretched to capacity in parts of the country, it is a different story in Maryland now. Infections are declining. Hospitalizations just dropped below 400 for the first time since March. Joining me now is the governor of Maryland, Larry Hogan. He has a new book coming out this month called Still Standing: Surviving Cancer, Riots, a Global Pandemic, and the Toxic Politics That Divide America. That's a lot to bite off in one book, Governor. Thanks so much for being with us. Maryland has been through a lot, and things are obviously better this morning as we sit here. As you look at the rest of the country, as you look at these states, Florida, California, Texas, Arizona, that are seeing these steep increases in the number of cases and now numbers of deaths as well, what do you think happened?
Well, look, we're very concerned about what's happening around the country, and I don't want to take any kind of a victory lap, because while we're doing really well, we took early and aggressive action in our state, and so far we've had great success in dampening the curve, and as you mentioned, all of our metrics are trending in the right direction, but states surrounding us are starting to go in the opposite direction, and we're seeing what's happening in states across the country with spiking numbers in both cases, in positivity, in hospitalizations, in ICU beds, and in deaths. And, as you know, this virus kind of has a mind of its own, and it doesn't recognize borders. So people travel from one state to another. We're very much watching it. We've got to continue to stay vigilant and continue to do the things that got us in a good spot in the first place, which was, masking, social distancing, and everybody continuing to follow the guidance of the public health professionals and the epidemiologists who tell us what to do to stay safe.
So what do you think happened, though, in these states? Were these states not doing those things you're just talking about?
I think some of it is people not following the guidance and perhaps in some cases maybe moving too quickly towards reopenings. But in our state, even though we have the great numbers and our numbers are declining for the most part, and among people over 35, we're down to about a 3% positivity rate. But we are seeing a spike with people under 35. Younger people are tending to completely ignore the rules and not wear masks, not recognize social distancing, and crowd together in different places. And we don't have bars open except for distanced seated, dining on a limited capacity basis with, lots of restrictions. But those places that open up bars and packed in hundreds of people, that's a big part of the issue as I talk to my colleagues across the country.
You, along with every governor and every leader in every school district, trying to figure out ways to open schools safely as quickly as is possible and feasible. And we do have some, breaking news, because just moments ago, we heard from the head of the CDC who explained, because we were under the impression yesterday, Mike Pence said that we're going to get some new guidelines from the CDC, that what we heard from them before was too tough. This is what the CDC director just had to say about that.
Our guidelines are our guidelines, but we are going to provide additional reference documents to aid basically communities that are trying to reopen K through 12. It's not a revision of the guidelines. It's just to provide additional information to help the schools be able to use the guidance that we put forward.
So I guess they're not going to change the guidelines from May. Maybe they weren't too tough. Do you know what's going on?
I really don't. That's breaking news. I was confused by the president's messaging yesterday. Look, I'm the chairman of the National Governors Association. We had a great meeting on Monday, a meeting of all the governors on a video audio conference with all the governors, with the vice president, with Dr. Robert Redfield from the CDC, laid out the guidelines. It was helpful guidelines, I felt, from the CDC. Most governors thought so. I think in our state, and I think many governors are looking to follow the best advice of the CDC and our local public health officials. And, our state school superintendent and school board are working with our local school boards, getting the input of all the stakeholders, watching, making sure we're listening to the science. I thought some of the recommendations of the CDC were very helpful. And I'm not sure what it was that the president didn't like about it or why he was lashing out about his own administration's report. But I'm glad to hear they're not going to change the guidelines. And look, states and local school boards are the ones that are going to make these decisions. And we want to get kids back to school as quickly as possible. But we only want to do it in a safe way because we don't want to have, widespread infections in our schools.
Well, we know why the president didn't like them. The vice president told us the president thought they were too tough. That's what they said about it. And it's a problem for me if you're confused You know, you're supposed to know what's
Yeah.
going on. If you're confused, it's a real problem.
Well, actually, I'm not confused. I think it's the president who's confused.
Well, confused.
The
Okay.
governor seemed to know exactly. Yeah, we knew exactly what the CDC was talking about. We know what's going on in our states. We were just confused as to what the president was talking about yesterday.
It strikes me it's reminiscent of something that you have spoken about in your book tour, or pre-book tour, I should say. You did an interview with the New York Times where you said the president is sending mixed messages. You say, and this is a direct quote, you said everybody in the administration is sending the message that this needs to be taken seriously, and the president's sending the message not to take it seriously. How do you mean?
Well, I talk about this in the book, and I think, look, I think the vice president, the CDC, Dr. Anthony Fauci, a lot of folks, Dr. Birx, a lot of people working really hard in the administration and working very well with the governors and messaging to us about the things that we can do to work together to keep everybody safe. Sometimes the president says almost the completely opposite message right after we have one of these very helpful and fruitful discussions. And I just think sometimes it really sends the wrong message, and it confuses the public about, is it, you know, if everybody in the administration is saying it's not safe and we need to do these things, and the president says to ignore all of that advice and do what he says, I just think it's a mistake that the president's been making.
Yes or no, if you decided who you're voting for in November?
You know, it's a long way off. As the chairman of the National Governors Association, I represent Democratic and Republican governors, but we'll have plenty of time to talk about that between now and November.
Notable non-answer. Governor Larry Hogan, as I said, we appreciate you being with us. Good luck with the book. Thanks, sir.